Hello, I'm urologist Omer Erdamakaya. Today we are going to have a short video presentation about HPV vaccines and HPV treatments. HPV is a sexually transmitted disease that creates lesions that we call warts on the surface of the skin, epidermis, after transmitting sexually. It forms cauliflower-like, painless wounds in the groin and penis. We frequently experience HPV in urology clinics. When it creates lesions after infecting is very complicated. It can create lesions in a short while or in a long while. It can even create lesions after long years. Sometimes married couples come. The male has an HPV lesion, but the female doesn't. Women may take it wrong and think negatively. But HPV might have been transmitted before marriage, and when the body resistance decreases, HPV lesions can occur. Apart from that, how to treat HPV? The fastest treatment of the lesions is distancing lesions mechanically. For that, we use plasma cautery, electrocautery, or freeze with liquid nitrogen. Lesions can't form in the area that it was removed. It means that it can't be formed in the area where it was burned, but it can form in the skin around it, in another area. But this possibility of relapse is around 20%. If it happens, it can retreat. Also, in order to prevent its relapse, gel or drug treatments can be given to the patient to increase body resistance. Apart from that, the vaccine topic is very complicated in the literature. There are hundreds of publishing about it. There is a lot of tendentious publishing about the vaccine. There are hundreds of publishing supported and funded by the company that produces the vaccine and publishing supported by the anti-vaccine foundations. The argument of the vaccine company is, if you have the vaccine, the possibility of condylomas decreases by 90%. The possibility of cervical cancer is very low. In a lot of countries except for ours, the vaccine was included in the national vaccination program and started vaccinating boys and girls after the age of 9. But some countries like Japan, it was removed after being included in the national vaccination program. Because the vaccine may have serious effects in the first month after it was injected. For example, 120,000 patients were vaccinated in Japan and 1,000 of them were hospitalized. In negative studies about the vaccine, 85 deaths, 3 early menopause cases, and 3 other deaths due to clots in the brain were determined. But the vaccine company says that the vaccine has no relation to those. It's impossible to talk about the protection of the vaccine totally. Because, for example, in America, it was included in the program in 2006. It's not possible to see its results before 2025. In males, apart from genital warts, causing cancer is very rare. I've never heard or seen, but it was determined 1 in 10,000 cases. The best way to protect ourselves from HPV is in our hands, which is not to be infected with it. And for this, suspected sexual intercourse must be avoided because condoms do not protect from it. Because it can be transmitted to the groin apart from the penis and cause lesions. Thank you for listening, best regards.